Hello and good day to you. This is Tracy Harrison from the School of Applied Functional Medicine. Today's topic is about intake sessions. It seems like such a lowly, maybe logistical topic, but those of you in particular who have been in practice using functional medicine in some sort of healthcare encounter likely well know that intake sessions are particularly powerful and often overlooked opportunities to actually help your patients and clients to get better clinical outcomes. And so today I want to share with you some of the pearls, an opportunity to just reflect on the strengths and what might be missing from your own personal intake process. I want to dive right in terms of talking about the notion of an intake session. Whatever you might call it, right? It's your first live encounter with a person who you are hoping is going to trust you, not just work with you, not just become a patient, become a client, join your docket, pay the fee, add themselves to your registry. Someone who is going to trust you to partner with them to help them to have a completely different future than what they have experienced in the past, where they can build on the strengths that are already present in their lifestyle and reverse and change and, most importantly, sustain those that aren't working. And when we highlight it as the intake session is the first significant encounter to build trust, not just to gain information, not just to document facts, not just to complete their profile and, get their documents started, get their paperwork started. We want to think of it as our first precious and perhaps the most poignant opportunity to build trust. And so I'm going to cover today a combination of sort of clinical concepts and then also some scientific concepts to include. One of them, I think, is straightforward for most practitioners who are savvy in the practical application of functional medicine. But this is the notion of using a good, detailed intake form, which I believe really needs to include a symptom checklist, not just a place for them to list their major symptoms or their major complaints, because very often, some of the most important puzzle pieces about a unique patient's disease dynamics are things that they will never think to tell you, not because they're not willing to, but simply because they don't know it's important, or they don't remember. Their normal is their normal, right? Out of sight, out of mind. For the most part, we don't think about our norms. We think about exceptions. Someone who has a bowel movement every week will tell you that they're normal because their once a week bowel movements are consistent and therefore not notable to them. And so the onus is on us to ask not only good comprehensive questions, but targeted high mileage questions in order to make sure that we don't miss key puzzle pieces in being able to well understand what is at play in a unique person right from the beginning. And a symptom checklist, something that lists out, I would say, a minimum of 100, maybe 150 or more, a list of symptoms where a person can simply check off what they're experiencing now or in the recent past. I will often recommend that my own clients tell me what they've been experiencing either now or up to 2 years in the past. And is it chronic or is it episodic? And if it's episodic, why is it episodic, or how frequently, or do they sense a trigger? Do they know why it happens then, or how that might come into play? Many times people will have as primary complaints just 1 or 2 symptoms, but then when you have them go through the checklist, they may identify easily 20, 30, 40 other things that, again, may not be of note to them, but they're critical scientific insight for you as a practitioner, especially because through the functional medicine lens, so much of the potent interconnectedness that we see and can learn from and act from clinically from an intervention perspective go across traditional physiological systems, go across traditional silos of medical specialties. And so a person who is maybe coming to you with certain types of gastrointestinal distress, right? They're coming to you because of IBS. They may not think that it's important to do a thorough inventory of their sleep their sleep experience. They may not think to give you good detailed information about their current sources of stress. These are just not necessarily the kinds of things that will come into play. They may not think about their personal hygiene products or toxic exposure or their dental history as being of note. And so what we don't ask, we tend to not learn. And so a critical component of an intake session is that now is the time to certainly engage and have discussion and rapport with the client, but largely being quiet and listening. We don't learn things while we're talking. We need to create lots of space, including sometimes poignant moments of silence, to allow a person to think. Sometimes we're so rushed for time that we're not giving people just the space to reflect for a moment and give us the answers that we are seeking, and listening, creating white space so that people can really share their stories, share their history, share their intuition about what is at play in their bodies, can actually take place. So for sure, you want to use a symptom checklist along with your detailed intake form. I don't think there's one magic intake form. There's thousands of different options out there in the functional medicine world, and you're going to have targeted questions based on your particular patient population and your expertise in terms of the disease dynamics that you most often work with. But a critical aspect of how you orchestrate the intake, I believe, is requiring that all this paperwork be submitted to you in advance, at least one whole day in advance. Depending on your scheduling, you may actually want to ask for it 3, 4, or 5 days in advance. This will give you plenty of schedule opportunity in order to review it and assess it beforehand, proactively. But even if you're in a shorter session, more tightly scheduled clinical or business model in your practice, one of the most important reasons why you want to make sure that your patient submits all this paperwork early is because they have had time to thoroughly reflect on their history, on their current situation, on their current choices, on their current symptoms. They will have brought to mind a lot of the data that you're going to want to learn. Please never make the mistake of just having someone come in and wing it, asking questions on the fly, hoping that you think to ask what's important and they think to tell you what's important. I believe that's a recipe for a very inefficient session. Ideally, you get the opportunity to thoroughly review intake documentation in advance of every session. This might, if you're relatively new to functional medicine, this might take you an hour and a half to really go through it, to make a list of a half a dozen good targeted questions and areas of exploration that are unique to this person, where you can do a deeper dive, where you can show that you've prepared and you're present and listening for this session, again, as a way of building trust and connection. But let's say even you don't have time to review it, or all you have time for is a quick 10-minute perusal and quickly jotting down a list of focus areas or inquiry topics on a Post-it. Even that is so much better than nothing. But as I said, even if you don't prepare, the preparation that the patient did in pulling together all of these answers and assessing themselves, reflecting on their history, thinking about what they want to share, what they want to explain. This is essential. It's not just prepping you, it's having a process, a standard process that requires their preparation. I actually think one of the best uses of your time and setting clear boundaries with your patient up front is requiring that documentation. And then if it is not submitted on time, simply having your team reach out to them and say, we appreciate life gets busy. We're just going to need to reschedule your intake session so that your documentation is submitted well in advance. This helps to clearly set expectations right from the beginning that you are going to be counting on your patient to follow through on their areas of ownership, just like you're going to come to the table focused, grounded, and with the best of your expertise, which quickly, these boundaries very quickly deflect the notion of the patient somehow being just a recipient of being fixed by the practitioner. which through the functional medicine lens we know is a real disservice and a critical boundary and expectation to set early on, because it is only through savvy clinical partnership that we can support individuals to transform their lifestyle choices and sustain healthier foundations so that they can actually get well and stay well. So when we are running an intake session, another reason we want to prepare is because in order to build trust, you must make eye contact. Way too many sessions these days, unfortunately, are conducted with an individual staring at a screen, taking notes, and really not making eye contact with this individual who is making themselves vulnerable to you. They are showing up, hopefully with not fully jaded presentation, where they're trying to trust you. They're trying to assess, especially through initial impressions, whether or not you might finally be the person who can partner with them in order to change their future. Keep in mind that when you include functional medicine in your practice, people are going to seek you out naturally, typically, for more advanced disease dynamics. Advanced or complex dynamics, maybe not through the functional lens, but through the conventional lens. You may be not just the third or fourth, but maybe the fifth or the seventh or the 12th practitioner they have consulted. And many times there, it's very reasonable for people to feel jaded, depressed, a bit of hopeless. They have some hope, but they're road weary for all of the prior intake sessions, all of the prior experts or specialists they've seen. But they are putting in time and effort. They're following your process. They paid your fees. They've scheduled the appointment to put themselves in front of you vulnerable, to connect in hope, in trust to some degree that this will be different, this will be new. And it's so important that we are prepared in order to be our best selves. And we need to make eye contact. We need to be able to be listening. Part of this is being well prepared in advance, courtesy of that early paperwork. Part of that is also taking care of ourselves. It's not a surprise at all that if we are unrested, unnourished, highly stressed, ungrounded, very distracted, we're not going to show up with our best work. And even if people aren't very savvy about medicine or the dynamics or science or medicine of what's going on in their bodies, most people have plenty of common sense to sense when the person in front of them is not focused and honoring them as the current top priority. And so our self-care is really essential. We want to show up for these sessions rested, grounded, having set aside other competing distractions so that our own woes and challenges are not distracting us from being present from the person in front of us. And I have certainly rescheduled intake sessions when I did not feel at my best. The last thing I wanted to do was set a first impression with this person that I am not grounded and focused and positive and warmly delighted to be meeting them and receiving the opportunity to help them. We want to be nourished. We don't want to be having a hypoglycemic episode and be exhausted from bad sleep the night before and still ruminating about an argument with our spouse and rushing into the session. Oh my gosh. Do we think that's creating a healing a pro-healing environment? There's plenty of research now into the placebo and the nocebo effect to help us understand that the clinical encounter is part of the medical intervention. The way you show up matters. It's not even just a matter of what you say or what you think or what you recommend or what you do as a practitioner to engage more from an intervention viewpoint. It is literally about how you show up. And if we are not taking good care of ourselves, we are much less likely to be focused. We are much less likely to be positive and optimistic, glass half full in terms of supporting them. We are less likely to be compassionate and present, especially as they begin to reveal some of the things that they do that may not be so health promoting, things that they may feel self-conscious about, even embarrassed, or nay, even shameful, we have to go to a special focused effort to create an openness in our body, in our face, in our warm eye contact, right? If we're sitting and hunched over a computer, this isn't a very open posture. If we are sitting, whether it's in a a virtual encounter like this, or in person, where we have an open body posture, right? Where our hands are loose and relaxed in our lap, where we're taking notes for sure, maybe occasionally typing, maybe occasionally writing notes, but we are generally really quite present for them and are able to smile encouragingly when they hesitate. In order to help them to share the full complement of what they want to open up and make clear to us as partners in the adventure that lies ahead. So please don't lose sight of the criticality of your self-care in making this connection. The reality is the placebo-nocebo balance begins to be formed right away. And we all know it's human nature. First impressions tend to be really strongly formed. And if we don't create good, positive first impressions, we often have to work quite hard after the fact in order to reverse the trajectory of those expectations. Now, I want to talk a bit about actually diving into the session and making sure in particular that you have asked a good extensive complement of intake questions on your paperwork. And the first one is asking people to begin from the beginning. And this is not just about creating ample space on your intake form for people to tell their story. When did you first start to feel what you're experiencing today? Or when did your current primary health challenges show up? We want to go all the way back to the beginning and ask people about their experience in their mother's pregnancy, in their birth, and in their childhood, especially in their early childhood. Again, we have plenty of research today that understands the in utero environment does play a role, especially with regard to things like drug exposure, antibiotic exposure, antidepressant exposure, mom's toxicity exposure. So it's not just about smoking and street drugs and maybe spousal abuse. It doesn't have to be these more dramatic circumstances. I think a real high mileage question you can actually ask on your intake form is, do you think your mother had a pleasant, well-supported pregnancy while she was carrying you? And just leave it open like that. And then they, yes or no, and why? This can bring up all sorts of questions about the health of your parents' relationship, the level of stress, drugs, medications, toxicity exposure, all sorts of things that, again, if we don't ask a targeted question, we may not learn about. It's also important in speaking about a childhood, I think, to just ask people on a scale of 1 to 10, how would you rate how overall stressful your childhood was? Why? Right? And whether it was a 10 or whether it was a 1, why? Right? And then a second question is, on a scale of 1 to 10, how would you rate your overall happiness during your childhood and why? So we get an opportunity for them to present facts and an opportunity for them to present emotions and experiences. Keeping in mind that people's personal experience of stress, crisis, trauma is subjective. It's not enough to ask people what were the facts of their childhood, because then we're going to put the veil, the screen of our interpretation on top of their experiences. Some people experience pretty crazy childhood dynamics, and because they had other mechanisms of support, it's just not a big deal to them. So they may report some crazy stuff went down in their childhood, but they will say that their happiness was a 10. That's really fascinating and something we don't want to assume. On the other hand, people could present what seems to be a fairly magical, optimal childhood environment, but they tell you that their happiness was a 9 and their stress was a 15 on a scale of 1 to 10. It's not about objective facts. It's about their perception. And what people perceive as childhood crisis or childhood trauma or ACE events, right? Adverse childhood experiences is up to them, is their definition. There are well-acknowledged, straightforward checklists, right, that you can give people in order to fill out about their childhood experience. But I'm not a believer in offering them those checklists right up front as part of their intake session. And that is because until we have had a good, grounded, focused, galvanizing, inspiring rapport and trust building session, we likely are not going to receive from this new patient the full truth, the full explanation of what is at play. Simply because it's human nature. I don't trust you yet. I have no idea whether or not I can trust you with this information. I don't trust you to purposefully or unpurposefully make me feel ashamed of my past or make me feel guilty, right? Or I'll end up regretting that I shared that information with you. And the questions on the ACE checklist are really quite in your face and targeted. They're wonderful things to share, maybe in the second or third session that you have with someone, assuming that you've built a lot of rapport and you believe that it feels like a safe time to have them answer those questions. And I also encourage you to have the ACE checklist be something that's in a template email that you email to them so that in the privacy of their own time, they can type out their answers to your questions. They don't have to look at you while they share maybe some of their most vulnerable truths. So they can submit the answers to those questions and you can discuss them later on. I actually think an excellent last question to add to the standard ACE checklist is a final question that says, thank you so much for sharing this important information. I want to respect your privacy. Would you be open to discussing any of these with me in a future session together? It is a-okay if you say yes or no. You can imagine that if you've been someone who struggled with ACE events, what a reassuring thing to say, especially if they've shared with you some truths. They may not be ready to think about, okay, if I share this, you're going to make me go there. You're going to make me dive into that, and I'm not ready for that. Sometimes it can be so powerful just to have people share, yes, I had these experiences, and no, I don't want to talk about them. And that alone is massive information for you in terms of customizing your approach and engaging with them in order to help to build a positive placebo effect, but also for respecting their boundaries, for helping to protect their privacy and protect their boundary session, right? And so I think in the beginning, asking people about their level of happiness and their level of stress is just helpful information. And sometimes the very fact that you asked will inspire people to tell you. You know, maybe they feel very comfortable telling you, I want to tell you more about that thing right there. And I haven't thought about it in years, but wow, it was a big deal. Or wow, this was an amazing thing, positive or a negative, right? It's less, nobody's going to go back and fix their past. And to the questions here, we're not trying to build a therapy session. What we're building is rapport and connection and trust for someone. So another question that I think is essential to have on your intake form, and shifting gears now into a little bit more about physiology, do you have any missing or damaged body parts? I cannot tell you. It is literally a long-standing joke on the practitioner forum here at the School of Applied Functional Medicine, because it seems like everyone has worked with someone who has forgotten to mention that they no longer have a gallbladder. Or they've had their appendix removed, or they've had their tonsils out, or they've had a traumatic brain injury, or they've had a an intestinal resection. Depending on how long ago it was and how adjusted they are to their new norm, they literally may not think to tell you if there's been some type of dramatic event in the past, especially if it happened in their childhood or many decades prior, and especially if what they're coming to you for is associated with a completely different body part, right? And so it helps to just not guess, but to just ask a wide open question. Do you have any missing or damaged body parts? It's also, I think, important to ask people about, has your body experienced any type of trauma? Right? That you feel is contributing to what you're wrestling with right now. And so we think about things like car accidents, right? Injuries, maybe falls or sports injuries. But also this provokes the opportunity to say, for example, injuries, accidents, surgeries, invasive diagnostic procedures. We don't want to overlook the notion of people, for example, who may have received different imaging diagnostics using contrast that they may not have detoxified well. People who have had traumatic colonoscopy experiences. Surgery may be life-saving and very well recommended and well executed, but it's still strong trauma to the body. Sometimes when you're asking about drug history, people don't necessarily know, or they may not be thinking about medications that they received coincident with a hospital visit or with a surgery, because it's not something that they may have continued to take at home where they're thinking about it. There's a bottle and a prescription and they're more aware of it. It's top of mind. This is especially the case for things like steroids or antibiotics, right? And again, by having open-ended questions, we leave them to define what they think meets the list, but sometimes just giving an example, for example, this or that, leaves them some blank space to share what has felt maybe traumatic to them. And I've always been surprised at what actually ends up being shared that could be a key contributor to your ability to assess through the functional lens what is at play. It's also critical to ask about things that are often completely left off of intake forms, such as dental history. My goodness, it just blows my mind that we know so much disease begins in the gut and the mouth is the top of the gut, right? It's the entryway to the gut. Where a lot of goodness or a lot of badness goes down. We talk about everything from the importance of how we breathe and learning whether someone is a normal nasal breather or a mouth breather. And that being a mouth breather can be very dehydrating to the mucosa in the mouth, which impairs immune function in the mouth and leads to increased incidence of dental caries. And so greater likelihood of more dental procedures, maybe periodontal disease. We want to ask people about their history with regard to root canals and cavity fillings, right? And asking them whether they are metal fillings, right? Mercury amalgam fillings, or whether they're made of some other composite material. This also is an opportunity for them to share a bit about whether or not their dental history is really traumatic. I've had a number of people, when we're talking about stress, claim to me that the only thing scarier than death and public speaking is going to the dentist. It can be a very traumatic experience for some people, especially if they had a lot of dental work when they were a child, and maybe they didn't have good support for that with regard to the therapeutic encounter with the dentist or maybe with a parent. I met a woman one time that was working with me where she had a lot of dental work, but both of her parents were very busy executives and they used to drop her off at the dentist. have the dental hygienist meet them at the door and take her inside. And she said, I felt like I was going into a lion's den every time. There was no one to support me. And I had to navigate that by myself. And she was still having in her mid-30s nightmares about, being sent to the dentist, like she's being sent to some type of, abuse type of experience. And again, the priming of the sympathetic nervous system, even for children, the priming of amygdala hypervigilance is about early childhood stress, and it is subjective. And it has a massive effect on predisposition to a rich variety of downstream disease dynamics. We teach a lot about that at the School of Applied Functional Medicine because we have to be willing to go there and very carefully make sure that we're not trying to, and if you're a mental health professional or a counselor or a psychologist, psychotherapist, this type of thing, then there's a natural overlay into your primary expertise area along with the functional medicine type of intake. But understanding who is this unique individual without having to go into an inventory or a repeat, or certainly not trying to inquire or resolve long ago past events, such as someone might experience in a therapy session. But understanding the state of someone's stress is an absolute necessary component of an intake if you're going to be successful in really pulling together all of the puzzle pieces through the functional medicine lens. Another key area, of course, to explore is about drug history. And it's not just a matter of thinking about what are medications that you're currently taking and what is the frequency, what are you taking them for? Always a really important question because if you ask them, when did you start taking it? How often are you taking it? And what are you taking it for? We all know sometimes people are continuing to take a medication or a supplement for that matter that was recommended to them 10 or 12 years later. They haven't gone back for a follow-up. They're still taking it. This occasionally is an issue with a prescribed drug. It's often the case for an over-the-counter medication. We want to make sure that we prompt people in their medication history section to think about things that they would often forget, such as oral contraceptives, such as over-the-counter proton pump inhibitors or H2 receptor blockers, or the fact that they use Benadryl or Tylenol PM to sleep every night, or even simple things like Tums, calcium carbonate tablets as an antacid. We have to prompt them to mention these things because they often will forget because if they're over the counter or if it's something they're taking for what they think of as a non-medical need, like birth control, they often may not think to mention it to you. We see this happen quite often. But it's also key to ask, what medications have you taken in the past but have stopped taking, say in the past 2 years? Sometimes people were taking proton pump inhibitors for 2 decades and they stopped 6 months ago. And unless we ask that question, we don't know that indeed that was likely at play in a disease dynamic that maybe started 3 years ago that has been progressively worsening, and they're finally seeking your help in order to counter it. And so I think this is really essential. Antibiotic history in particular is key. I've heard people say things like, I haven't actually really taken antibiotics. I mean, I take a Z-Pack a couple of times a year. Apparently a Z-Pack is so everyday, so normalized, so ritualized that we don't think about it as an antibiotic anymore. These are things that we have to engage with. And so making sure that your intake form is simply triggering them to gently reflect on and maybe recall some of these commonly overlooked items, again, can just help to make sure that you get a thorough intake. I want to share with you some high mileage questions in particular that I think can be key for you to put on your intake form. Again, especially to try and sweep to make sure that we haven't overlooked some things that are essential for us to know. One of them is simply to say, What is the most important thing for me to understand about you as we begin this partnership to support your health? That's a nice wide open question where someone may share something they don't want to talk about. Someone may share something that they feel is in the way of them making improvement. Something that someone may feel like is a critical part of their health history that they didn't feel like any of the questions triggered. Maybe it's something they're not willing to talk about, or that they're afraid, don't tell me to not eat this. I'm not willing to do that. Okay, great. Excellent. The second question that I think is really essential to include is, what are 3 healthy lifestyle choices that you are consistently making right now that you're proud of? It's an opportunity for people to share something that they feel great about. They may be tiny things, they may be major things, but it's a chance for you to celebrate something during their session. It's going to give you key pearls on something that maybe is already easier for them to improve. Maybe there's nothing on there that's diet related. Maybe everything on there is diet related. Maybe everything on there is stress management related, but it's a chance for you to build on successes. So as you start to engage with them and make recommendations, you can build on something that's already working for them, right? I remember a gentleman one time who shared with me, I know it's not a big deal, but I eat a bag of frozen broccoli every day. And I remember just celebrating the heck out of that, right? Oh my gosh, that's a lot of broccoli. That's fantastic. And just talking to him about, so you like frozen vegetables? How do you prepare them? This is great. This is awesome. Is there an opportunity to maybe change it up a little bit? Is there a second vegetable that maybe you could do every other day? Still buy it frozen, still prepare it in the quick and easy way. Maybe it's a chance to say, do you buy organic broccoli? That's a chance to build on that, right? We want to know what they view as successes, and they're things they're proud of, things that we can celebrate. Celebration is a 100% essential component of your therapeutic encounter if you want to help people to stay with you, to stay engaged long enough to get well and stay well. We want to find, even if it's the smallest step forward, something to celebrate the heck out of. Every session should involve some significant celebration. And then the third question is, often there is something unexpected, unusual, or even downright crazy at play in contributing to your health challenges, either in the past or in the present. In your particular case, what do you think that thing might be? It's a great question because people share incredible things. They may share the thing that they think 4 years ago triggered their autoimmune disease that they have shared with multiple other practitioners, but has been poo-pooed so many times. They might have otherwise felt shameful in mentioning it, unless you had said, no, it's okay if it's unexpected or unusual or downright crazy. That's actually what I want in this question. It may be, so how I phrase it is, it's a statement and then a question. Often there's an unexpected, unusual, or downright crazy thing at play in contributing to a person's current health challenges. In your particular case, what do you think that thing might be? And, it will bring up just a comical thing, a dramatic thing, a traumatic thing. It may be about mindset and attitude. I think exploring mindset is a really critical question to raise at some point in your engagement. Sometimes people will put on their intake forms on a scale of 1 to 10, how would you rate your overall positivity about life? Or what are the top 3 or 4 words that describe your typical everyday mindset? These are things that can be really powerful in terms of understanding who an individual is, in ways that the vast majority of other healthcare encounters are not going to honor as being not just a involved in their emotional experience of life, but involved in their physiological and biochemical experience of life. So high mileage questions that create open-ended space, not wide open. Please do not put, tell me your story. You're likely get a 4-page single-space document back. And I actually think having someone tell their story in person with you is actually much more poignant and a more important and efficient opportunity to create rapport and trust, because they have an opportunity to share it in all of its craziness or ugliness or embarrassment or shame, and for you to simply be present and to nod and encourage and be quiet and have an open body language, to smile occasionally, to not talk over them, to just create space and let them tell you in person. That is generally going to go do more in establishing rapport and trust. And then last of all, I just want to end today on the note of, once you've had this session, you've had this discussion, I think it's really important to do 2 things at the very end. One of them is to say thank you. To say thank you for putting in the time and the focus to pull together all this information. I appreciate that it probably took you a lot of time, and it's a really important part of our work together. And I thank you for doing that. And I thank you for being here and creating the opportunity for us to work together. And then the second critical thing to say, again, while you're looking at them, is, I am confident that I can help you. I am confident that I can help you. You're not saying, certainly not at the end of an intake, I'm confident that I can fix you. I'm confident that you can reverse their disease, or that I can make this marker go away, or I can make this symptom go away. I don't recommend you say any of that. Please don't make false promises, because even if you can see ahead of time what you think might most be at play, you cannot speak for what they are willing and able to do. And this is a savvy clinical partnership. This is going to be about teamwork, and you can have all of the most amazing insight, but if we can't create a rapport and support for them to follow through on lifestyle change, it's not going to be worth very much. And so you can only speak for yourself, but they have invested you with a level of authority. They have invested you with a level of belief and trust, and they need to hear you say that you are confident. The last thing they need to hear you say is, well, not sure if we can do anything here to help you or not, but sure gonna try. Really? Does that feel inspiring? Does that feel like a placebo effect? I think it is essential that we speak our truth. And if your truth is, you're very grateful that they have shared so much with you, but you, in your heart of hearts, in that moment, do not believe that you are the best practitioner for them, then tell them that then. Tell them that then. And that you are going to give them a referral, and that you're going to help ensure that they find, you're going to help to connect them with someone who could be a better fit, right? But that closure, I think, is a responsibility. And I believe we create a very strong placebo effect when we say, I am confident that I can help you. This sets an openness, oh my gosh, no one's ever said that. And sometimes you can literally see the relief. They will smile and they will sometimes cry, because they have been waiting for someone to say that for a very long time. And then they may get all giddy and really like, what all do you think we can do? And just what all you think is possible? And you, again, you don't want to get drawn or hooked into false promises as a balm in the moment, in the stress of the moment, right? I'm absolutely confident that I can help you to work toward your goals. And as we work together and learn more and explore, we're going to get a strong feeling and assurance of what's going to be possible in your unique case, right? But please don't give an equivocal view of your confidence and your capability in the moment. Just because you don't know everything yet. Of course, we don't know everything yet, right? We're just beginning. But people need to hear that you're confident. And so these are some pearls for having successful, galvanizing, inspiring intake sessions. It's not just about people making the appointment. It's not just about showing up. It's not just about having a lot of good questions about what's your history of diagnoses, what's your history of surgeries, and all of these more kind of classic questions. Those are important, of course, but there's some devil in the detail nuances here that we've learned over the years supporting thousands of healthcare practitioners that are essential for establishing the initial stages of trust, which is absolutely essential for helping you to partner with someone so that they can get well and stay well.